Hi, it's Sandy Wyllie. Welcome to my mental health channel, where I wipe away the stigma of mental illness by talking about my own personal struggles and experiences as having borderline personality disorder. I talk about narcissism, I talk about post-traumatic stress disorder, anxiety, depression. I talk about all the different kind of therapies I've been in, and unethical psychologists, and a plethora of other mental health related topics. But I only come on as a former patient of almost 20 years, yes. I am not a licensed therapist. I do not hold a degree in psychology. So I cannot diagnose you. I cannot offer you a professional opinion. I can only share my own struggles and experiences. And all I ask in turn of you is to show kindness and respect in the comments. Please be kind to me. Please be kind to everyone that comments. We don't have to agree on everything, but we do need to agree on showing each other respect and kindness. Now, if you are new to my channel, welcome. If you haven't already, hit the subscribe button because it's 100% free. And if you like what you see, hit the like button. It's only a click. And I hope that you comment. I love when people share their own personal struggles and stories with me. Now today, I'm going to talk a lot about how people label people with mental illness, how people judge people who have mental illness, and how people don't take people with mental illnesses seriously. Like, for instance, I have borderline personality disorder. So a lot of people say to me, oh, you're just a drama queen. So I can't express anything, any kind of suffering that I have. People, think I exaggerate, and they think that, I just want attention, that I'm just an emotional woman, They don't take me seriously. And that really hurts me, because I have legitimate feelings, I have legitimate worries, I have legitimate concerns, and I'm not being a drama queen. I believe that, like my son was hospitalized this past weekend. He was very, very sick. His sodium was critically low, and he was showing a lot of, he's handicapped. He's in a residence home for brain injured children, and he was showing a lot of aggressions, and they called 911, and he was hospitalized, and they found out his sodium was critically low, that he has this condition where he retains fluids, and because of that, his sodium levels drop. He can't allow, now he's on a strict diet, he can't just, he's restricted in what he can drink, because if he drinks too much, his sodium will drop, and he could go into seizures, and it's not a pretty picture. But I got very upset, and I was beside myself. This is my son. He was hospitalized. I also got some post-traumatic stress disorder about last time when he was hospitalized, when he lost his mind and he got pneumococcal meningitis. And I think any mother would feel the way I did. It's not just, but people weren't taking me seriously because I have borderline personality disorder. They would think I'm being, oh, she's a drama queen, that she's getting upset because my son was hospitalized, because my son was critically ill. They were going to admit him to intensive care unit. That's how ill he was. And I don't think that, it had anything to do with my borderline personality disorder. I think it had everything to do with me being a mother and very worried about my handicapped son. but people see or know that I'm borderline, so they slap that on and say, oh, she's just overreacting. She's overly emotional. She's a drama queen, when it had nothing to do with that. It had everything to do with any mother would be upset. I'll give you another example. My father was at McLean's Hospital because he was, aggressive again, just like my son, because my father had paranoid schizophrenia. So he was hospitalized at McLean's, a mental health hospital. Is for, mental illness. People go there. And my father would not eat the food there, I saw my father. I brought my father out to dinner prior, and every time he took a bite of food, he's clutching his stomach in pain, like this. He's, So I knew something was physically wrong with my father. See, when you have a mental illness, doctors and other people overlook that there could be a physical illness present. I told the nurse that, I think my father has cancer, and I was right, he did have cancer. That's why he couldn't eat. Every time he tried to eat, he had a massive tumor. So, his stomach pressed down on the tumor, and he physically could not eat. He was physically sick. He was dying of cancer. But they would not listen because he was schizophrenic, and he was in a mental hospital, and they said he's not eating because he's paranoid and he thinks the food is poison. And I said, no, that's not the case. I had a fight with the stupid nurse. I said, I seen my father clutch his stomach when he tried to eat. He was in physical pain. But because he already had, a mental disorder, they ruled out anything physical without checking for the physical. Now with my son, they did the same thing. Where he was living, they wanted to lock him up in a psych ward. They wanted to give him a psychological evaluation because he was acting aggressive, and my son has traumatic brain injury. But he was acting aggressive. It wasn't because of anything psychological. It was because of something, medically wrong with him. He had critically low sodium levels that he needed to be they were almost going to admit him to put him in an intensive care unit, because he had to be hospitalized. This is the third day now he's in the hospital because of this. It's a medical condition. He was not acting aggressive because of a psychological condition. My father was not eating, not because of a mental condition that he thought the food was poisoned because of his paranoia. My father was not eating because he had a medical condition. He had cancer, and he had a big tumor, and it was too painful with that tumor. It pressed on his stomach, so he could not eat. But people who have a pre-existing psychological condition, all right, they don't take people like that seriously, They don't think that that person could also have a medical condition that causes the symptoms. Like my son had a medical condition. He had very dangerously low sodium that was causing his aggression. And like my father had a massive tumor. My father was only 71 years old when he died. And, he was all skin and bone. He just, he died a horrible, painful death of liver cancer. But they would not take him seriously because he was schizophrenic. See, because he had a pre-existing psychological condition, schizophrenia, they did not take him seriously and look into that he could be experiencing a medical, setback or a medical condition along with the psychological condition. What I'm trying to say here, what I want to drive across, which is very important in this video, is that if you have, a mental ailment, or if like traumatic brain injury, or you have schizophrenia, or you have a personality disorder like borderline personality disorder like me, more often than not, you will not be taken seriously. I could have a medical condition, okay? I had a medical condition one time, and I went to the doctor's office, and they kicked me out because I looked angry. I was in pain because I had severe GERD, gastroreflux disease, where the acid splashes from your stomach into your, esophagus. That was a medical condition, but because I was borderline, the doctor treated me with contempt, and he didn't believe me that I was suffering a medical condition, and he kicked me out of the office for looking, I don't know, for looking angry or some crazy excuse like that when I was really in a lot of pain. So I hope that by listening to this video, that if you know someone who has a psychiatric condition, or a mental condition, a psychological condition, that you take them seriously, and not because they could have a medical condition as well that's affecting their behaviors. Just because they have a psychological condition, you shouldn't rule out that there could be there could be something else affecting that person. Like the nurses ruled, thought, that my father wasn't physically sick. They said he's schizophrenia. Yeah, he's a schizophrenia. He's a schizophrenic who happened to have terminal liver cancer, okay? Just because he's schizophrenia, has schizophrenia doesn't mean he can't get cancer. Just because my son has traumatic brain injury that causes, behavioral issues, doesn't mean my son can't get other conditions that will cause him, to become aggressive, and very critically low sodium is one of them. And just because I have borderline personality disorder doesn't mean, oh, don't take her seriously, she's over emotional, when I could have a health ailment that's making me, affecting me, That's why it's very dangerous for these professionals to rule out the medical when someone walks in with a psychological problem. You have to look at the whole person, which includes the mind and the body. And just because someone has a mental illness, you can't rule out that they might have a medical condition as well, just because they're schizophrenic, or just because they have traumatic brain injury, or just because they have borderline personality disorder. You can have, a mental condition and a medical condition pre-existing at the same time. But people in the medical field, are ignorant to this, and they think just because you have one, that omits you from having the other, and that's not true. They don't take people with mental health problems seriously, and this is to everyone's detriment. To the patient, because it could put the patient in danger without getting medical treatment if you just whitewash it and say, oh, don't take her seriously, she's overly emotional, she's a borderline, or don't listen to him, he's schizophrenic, that's why he won't eat the food. I'm telling you, you need to take people with mental health issues seriously. When they're hurting, and you need to take that seriously. You need to look into the body if there's something going wrong with them medically. People don't take us seriously enough, and it really, that's very dangerous. And that's all I'm going to say about it.